And we also have some folks online as well. So this session is being shown live, and we'll also have a recording. Just by way of introduction, my name is Christina Tonio, and I am a new member of the Center for Career and Professional Development, and specifically, I direct our efforts for industry connections. So basically, your typical employer relations function. And I joined USF just about 2.5 months ago, so fairly new, as is our whole team within Industry Connections. And prior to USF, I spent the last 20 years actually on the corporate side, representing our whatever organization it was, managing internship programs and full-time programs, selecting which universities to recruit at. So what these gentlemen are up here doing today is part of what I used to do. So coming in from the other perspective has been really terrific. And I have some other members of my team who are here. Ivan outside was checking you in. We got Edson over here. So you'll be meeting them throughout the course of the semester and beyond. And so just to give you a little bit of an overview of this event, we're very excited. This is the second of its kind. So these are career conversations, and they're really meant to show students that there are many paths that you can follow regardless of what your major is. Or if you think that there's only one type of industry that you can get into, we want to demystify that and show that for whatever industry that exists, there are many types of jobs and many ways to get there. And specifically, there's no straight path as it relates to career paths. So these gentlemen are here today to talk about how they got to their current organizations, talk a little bit about their companies, what they're looking for in terms of college hires, and I won't spoil the rest, but it'll be a good time. So we're going to keep the folks muted on the phone, but if there are any questions at all, feel free to stop us, and we'll take you off mute for those that are online, and obviously just raise your hand if you have any questions or comments as we go along. I'm good? Okay, so we're going to get started. I will turn it over to our panelists. If you could just start by introducing yourselves with your name, title and company, and how long you've been at each of your respective organizations.
My name is Guy Mitchell. I'm Senior Operations Director for Quest Diagnostics here in the state of Florida. That means that I basically covered the two major testing sites, one in Miramar and one right across the street here, across the street in Florida. I've been with the company for just coming up on my 20th year. I bleed Quest Green and can't think about working anywhere else because I found my home. And I'll tell you a little bit more about how I did that as we proceed.
Now, similar to Quest Green is to Enterprise Green, right? So I say that same thing. But, my name is Justin Henderson. I'm the Group Talent Acquisition Manager for Enterprise Now Mobility. We actually just rebranded last week. So we were Enterprise Holdings. We're now Enterprise Mobility, which is Enterprise Rental Car, National Rental Car, Alamo Rental Car, and a ton of other sites as well. So we have a lot of different long-term options. And I've been with the company 13 years, almost 10 years we spent in North Carolina. A little over a year we spent overseeing Oregon and Southwest Washington, and now oversee the Tampa City market. So nice to meet everybody.
Great time to talk to students about vast opportunities as you're growing, right?
Absolutely.
So we have some slides to share with all of you in terms of what our panelists do in their organizations and just a little bit about what their companies do, options they have available. So I think we have Enterprise up first. So Justin, I will pass this to you.
No, you're all good. You're all good. So
Over here. I want to see what you have to say.
appreciate it. So I left it as Enterprise Holdings simply because we're still kind of figuring out the rebranding and how we're going to market it from a standpoint of the opportunities. But you guys can all see all of the different lines of business. And so we have fleet management, and I'll spare you the details, but a lot of different business lines. Everybody starts as a management trainee, and you have an opportunity to grow based on your performance. I started as management trainee again 13 years ago in a small town called Wake Forest, North Carolina. And I've been promoted 11 times in 13 years. And so some reasons why to work for Enterprise, right? We're definitely the top company for recent college graduates and college athletes. We've obviously been listed as one of the top employers. We have a world-class management trainee program, which does as a long-term career paths, a promote from within structure, and I call it the 3 Ps, which is performance plus perception equals promotion. And so I'll kind of spare you all of the story, but I was a management trainee for about 10 months, got promoted to assistant manager, was an assistant getting promoted to larger stores over a 2-year period. So 3 promotions within that same title. Then I got promoted to branch manager, was a branch manager over 2 years, 3 promotions to larger stores. And then I got promoted to area manager. So right at 5 years, I was an area manager overseeing several stores. Then I got promoted into a regional talent acquisition manager role in the Raleigh-Durham, North Carolina market. And then again, Oregon, and now I oversee the Tampa St. Pete market. And our doors are open to everyone. So we're known as the customer service provider within our industry. National, Alamo, and Enterprise are 1, 2, and 3 in our industry from a standpoint of customer service. And so it's our way of life. We strengthen our communities one neighborhood at a time, and you all can see the culture of DE&I as well, and some things that we've really done to kind of put our money where our mouth is. So management trainee is an entry-level position with a career path where you can learn how to run a business. You guys can see all of the skills that you learn, and we promote 100% within our management trainee program. The CEO of our company started as an MT, so it's really that growth potential there. And just a little bit about kind of the path, and there's a lot of deviations. So for instance, I now am in human resources management, but everybody starts in this role or potentially as a management trainee intern, which goes into management trainee. And again, my story, I worked my way up to an area manager role, and then I went into human resources management, but all the way up to the top, the same entry point of management trainee is kind of everybody's shared experience.
Great slide.
Contact information, but I'll give you guys my cards at some point as well.
And I just want to comment, I love that your CEO started as a trainee. I love hearing those stories. You could start your entry-level job in a few months and have a career out of that.
Absolutely.
I think it's really, really rare these days, but it's a great story.
For sure.
Thanks for that.
Thank you.
My story is a little unique, and our company is a little bit different. We are a medical laboratory. This is me, my contact information, and I'm sure it'll get out there at some point, but I didn't bring any cards with me today because I'm not a natural recruiter. I'm actually the operations leader. But I'm sure that you'll have access to this. My story is a little bit different. I've got 2 degrees, nothing to do with laboratory. First in my family to go to college, the first in my family to get thrown out of college. Ran out of money, went to the military, and figured out I knew I wanted to be in healthcare. But through the military, I learned that I don't like sick people. So I love the healthcare industry, but I don't want to be around sick people that complain. So I went into the other side, and I went through their training and became a certified distal technologist. Now, I haven't practiced that technique in 35 years. I'm not even licensed in the state, even though I manage the people that have those licenses. But while I was in the military, I finished off my bachelor's degree and my master's degree. Again, none of them are in medical laboratory sciences. I've got over 35 years of laboratory experience, starting way back. I won't even tell you how old I am. Back in the United States Navy. I'm probably one of the only Navy personnel that you'll ever see that's never been on a ship. I spent my entire career in a hospital, working in my trade. From there, I went to OSF St. Francis, which is the largest private healthcare entity in the company or in the country. It's run by a group of nuns that actually still run it today, and it is a massive healthcare network in central Iowa and Illinois. From there, I decided to go to Loyola University and try my skills in the academic healthcare arena, which was absolutely atrocious. Talking about having 14 bosses at one time and no accountability and no responsibility, but all the accountability for everything that happens that goes wrong. From there, I went to Carolinas Healthcare, which is the largest publicly traded healthcare system in the country, and learned to cut my teeth even more. And about 20 years ago, I came to Florida. I joined Quest Diagnostics, and I've been promoted. When I first got here, I was the director of a small division, and I was a director of the Miramar Laboratory, and in the last 8 years, I've been the director of the state of Florida. So I bounce back and forth. I actually live in South Florida. So this is a nice little flow chart that tells us what you're doing. You're probably wondering why. How many people here are in the medical sciences? 0, right? Or business. We just happen to specialize. He's a business, he specializes. We specialize. But there's very few medical laboratorians or pathologists in our industry. The samples start way up here. And if anybody goes to the doctor, you go to your physician, and they decide to do some blood work. Or it is collected at the hospital or at the physician office, or it's collected at one of our draw centers. So There's leadership, there's management positions, at that aspect of the business, just starting off. There's sales teams that go out and they sell our business. We are a Fortune 300 company. Our stock today is trading at 125. We're up $2.14, I believe. That we just did our earnings release last week. We are all owners of our own company, even though we are publicly traded. From once the physician decides that you need to have some blood work done, obviously, as I said, you're collected. We have over 12,000 patient services centers across the country. There is 1/3 of the U.S. population sees Quest Diagnostic every year. At some point, that's how large we are. We are the largest laboratory in the world. Once that is done, the samples have to get to the main laboratories. The one right across the street of Fowler happens to be the 3rd largest laboratory in the Quest network. They do over 54,000 patient encounters every night. So the drivers end up bringing all that work into the hospitals. This is where I take over. I've got one little section down here. This is where we process, test, and report the results. 33% of all the healthcare decisions are based on my result. It's the physician is looking for my result to tell them what to do with the patient care. Without my result, they're flying blind. So you can see how critical it is to be in the laboratory and what we do. Then obviously we're reporting our results out, and we're giving those results out to the clinician. We're giving them out to patients these days. There's a new federal and state law that you guys have access to your own healthcare information. You might not know what it means, but we're obligated to give you a copy within 24 hours. Once we go there, then we have a whole different team that sits there and does nothing but diagnostic analytics. And they're serving the CDC, departments of health, various large healthcare companies, various third-party carriers. We're providing them data on the health and well-being of our company, or I'm sorry, of our country. And along that, we've got customized sales reps. We've got a whole IT system. We have database administrators. We have programmers. We're large enough. We build our own software. We don't buy it from anybody. We build it ourselves. We're that big. Along those lines, in between, there's biomedical engineers, there's financial analysts, there's sales teams. We have a whole division in our company, and there's 3 of them that report to me directly that do nothing but process improvement. We are a publicly traded company, so everything I do costs money. Me being here costs money, and I have to figure out a way to pay for it because I am truly in a business. We are constantly looking for people of that generation, that genre. It's not necessarily the med techs. You're not looking, there's a school of med techs on this campus. I already talked to them. This is the business side. There's so many leaders in this company that have similar backgrounds to I have that are not laboratories. Our CEO is not a medical laboratory. He's a businessman from GE. He was recruited up from GE. Most of the senior staff, they rely on the techs to give them advice to make sure we don't steer them off course with patient care. We have a whole team of medical professionals that make sure that we steer the right course. We have scientists. We have a whole research and development team if that's your interest in chemistry or biology. So it's a wide, diverse population and activities of things within our company. This is just some of the locations we have. And I show this not to brag about our size, but this is one of the advantages of going to a large company like either one of ours. You can go anywhere you want. If you don't like Florida, you want to go to California, you want to go to New York, you want to go to Chicago, you want to go to Texas, Dallas, Atlanta, or everywhere. This is why we're the largest. The purple dots or purple triangles, these are the main laboratories. The green dots are all our patient services all over the country.